Hi everyone, my name is Dr. Maria and I'm a doctor of physical therapy specializing in women's health. I am also the owner and founder of my clinical practice, Holistic Physio. Today I want to talk to you about urinary leakage, and for the sake of this video we're going to condense it down and only talk about stress incontinence because there are a few different types of urinary leakage. So when we talk about stress incontinence, this means that the external pressures, it could be laughing, coughing, sneezing, running, jumping, will be too much for the pelvic floor to control those pressures, and the urine in the bladder will leak out. So when we look at the pelvic floor, I have my pelvic model. And so when we look from the top down, you can see here the three different types of organs that sit in the pelvic cavity. So this is the bladder here, the uterus, and then the rectum. And I'll hold these in place so I can flip it under. Now, if we're looking from the bottom up, this is the bottom face of the pelvic floor. This is where we see our vaginal lips, and this is where the vaginal opening is at as well. And so if we are to take these organs out and more or less kind of keep the bladder here, you can see that the bladder inside of the pelvic cavity is surrounded by the pelvic floor muscles. So essentially, this bladder and pelvic floor muscular group kind of co-contract with each other. And so if the pelvic floor, not only weak, as some may always say, but it could be very tight, or it could have a lack of muscle coordination, meaning that it's just not communicating well with the surrounding structures. If all of that is off, then we're going to create too much pressure around the bladder. And if there is too much pressure around the bladder and things just, again, are not coordinating well, then whatever is inside the bladder, which is our urine, is going to dribble out. And this is when, again, there's external forces really challenging the pelvic floor to work and to do its job and to support the pelvic organ structures. So what we can do for this is pretty much try to dial back everything, right? So I'm definitely not a therapist that says, stop your running, stop your physical activity, stop. We might have to just modify and change things up a little bit. And so I always start with down regulation of the nervous system, or basically breathing. Breathing is a really great way to help calm down your body if it's in a heightened state, which usually is the case whenever I see pelvic floor conditions. And also the diaphragm that sits at the lower rib cage communicates and co-contracts with the pelvic floor. So if this is the diaphragm at the lower rib cage, and then the pelvic floor is at the bottom of the pelvis, it's literally kind of like the cylinder shape. And when the diaphragm contracts, it flattens, and then the pelvic floor is also going to flatten, and this is where it's stretched. Now the diaphragm sits back up and is relaxed, and the pelvic floor is going to contract and shorten back up. And so if we start with the breath and to calm the nervous system and essentially try to coordinate the pelvic floor and the diaphragm back well together, then we can have a better foundation where these external pressures are going to be much more well controlled. Now, if we're going to progress, we can progress with actually challenging the pelvic floor and the core muscles, because the core is basically the pelvic floor and a few other muscles, but we just have to continue to challenge it once we kind of get our breathing back and once we have a calmer system. And so there's a few different ways that we can challenge the core. I like to start first with exercises laying on your back. Once you feel pretty good with that, you can progress to hands and knees. And then eventually you can maybe go into kneeling, and lastly into standing. And again, you can move your arms and try to get a good core contraction. You can move your legs. I have a good core series up on YouTube. So that is a really great way where we can actually try to better enhance our system and control that urine from leaking out of the bladder. If you guys have any questions, please head over to my Instagram at Holistic Physio Doc, or you can leave them here in the comments and I'm happy to answer them. Thank you so much.